Hi, I'm nursing student Jason. Today I'm going to, according to my doctor's order, it says I have to do some NG tube management or care, which according to Dr. Order, I'm going to get a sample of your stomach contents, and then we're going to test it. And yeah, so do you have any questions about that? Have you probably had this done before? No? Well, I'm going to be sitting you up, and then we're just going to be. I'll get you up to a good height. I think just for the NG placement, I would want to sit you up. I think this one I can kind of leave you in your semi-Fowler's position. So I'm going to wash my hands, and but first I also want to make sure that you are who I think you are, and you are Mary Potter. Can I get your date of birth? All right, that's correct. And all right, do you have any questions for me? And is this procedure okay with you?
Yep, absolutely.
All right, well, I'm gonna wash up. I'll make sure I have all my materials, and then we'll get started. All right, thanks. Wash up. Put on a. I'm gonna recycle these. God bless you. And then put on some hand sanitizer and some gloves. Come back over. All right, so one thing I'm gonna do. I didn't bring my stethoscope with me today, but yeah, so I'm gonna have to listen to your bowel sounds if I could. I'm just gonna expose your stomach. And so, all right, I'm gonna be listening. I wanna see if you got 5 to 30 bowel sounds per minute in each quadrant. So I'm gonna listen, 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 and listen. All right, you're doing really good. All right, so right now, oh, I forgot. I'll have to do that again. I'm gonna turn off the suction and listen for a minute in each, listening for 5 to 30 bowel sounds in each quadrant. And then the suction has already been turned off. And so I'm gonna go ahead and I'm gonna raise you up just a little bit. So now what I'm going to do is, this would have been in here actually. So this sterile container is, I'm going to take that out. And before I touch the contents, I probably, although this isn't a sterile procedure, could have taken my gloves off after having touched the patient and everything, washed, sanitized again, and put on some new gloves. But so now what I'm going to do is I'm going to get at least a 10 milliliter bolus of air that I'm going to, but first checking placement. I want to see, so I see that this hasn't retreated out of the nose very much at all, and I see that there's still mucus and whatever stomach contents that are in the tube. So I know that, and they're not having any difficulty breathing. Are you having any difficulty breathing? No. So it's not in their lungs, it's still in their stomach, and so it's still sucking stuff up. So the tube placement is good. I'm gonna go ahead and disconnect this, and I'm going to send an air bolus. I'm just going to drape that over here. And just gonna send that down there to clear the tube. And now what I'm gonna do is I'm going to suck up 5 to 10 milliliters of gastric juices. And so I'll also be sucking up air along with it. And so I'm sure that there'll be a little extra, there'll be air on top. So once I get it, I'm gonna go ahead and disconnect and clamp this. Then I'm gonna come over here, and I'm just gonna kind of shake this up a little bit. I'm gonna go ahead and take my clean litmus paper. I'm gonna go ahead and put a little of the juices on it, and so that I can find out, I can discard the rest of the juices right there and find out what color it is. So I'll say this looks like it is probably a 5, which 5 would be pretty good for the stomach. The stomach's supposed to be acidic. So now what I'm going to do is I'm going to place this right here for the moment. I'm going to, with my hand on the label, I'm going to take the lid off and pour a little bit of water. I don't want to put actual water into the mannequin, but pour a little bit of water in there, and then I can suck that up. So I want to make sure I have 10 to 30, how about 20 milliliters of saline solution, or whatever the doctor's order may recommend, or but yeah, in this case, this is normal saline. So what I'm going to do now is I'm going to connect this right to the NG tube. I'm just going to send this down the tube to clean it. All right, if I need to, if that didn't clean it, I can do that again. But actually this is really clean. Look at that, holy cow. So now I'm gonna close that just for now. And I'm gonna go over here, and I'm actually pretty well done. I can go ahead and take off my gloves, sanitize. I want to get rid of all my stuff, clear this area out. I want to also, if I'm going to be reconnecting this, I can put some gloves back on, but I took them off, so I'm going to pretend that I just put gloves on again, sanitize, gloves back on, and let's see. So I'm going to go like so. Turn this back on. Make sure the person is comfortable, and see what their pain rate is. I would have asked that in the beginning. I'm kind of in a rush. We've got 6 videos to do today. So yeah, you're comfortable? All right, good deal. I'm going to give you your call light, put you in a comfortable position again, down to the ground, and I think I'm gonna call it a day.